Check. Check 1 2. Hello. Hello, test. Hello, check. Hello, hello. Hello, check. Thank you.
So good? No worries. Thanks, mate.
Because I'm sure you get that all the time. Yeah, like, I know you, you don't know me.
No, we went out for dinner last night to give it to the mates of my mum's birthday and succeeded in running into about 4 people that I taught yoga at some point. And my eldest looked at me, she said, "You have so many friends." And I'm like, yeah, what happens when you go to a team? You just become friends with everybody. That's kind of how it works.
Not with me.
It's like, you know, I'm your MC this morning. So
This year we're mainly virtual. So
Oh, that's okay. Yeah, that's right. I'm not being named. It's just, you know, my joke is that I've been into the beginning. Yeah.
It's alright, I've seen that actually.
Oh, yeah.
Good morning. It's nice to see so many of you here. It's wonderful. I'm Kylie. I'm going to be your MC this morning. Good morning, Lockie. I didn't get to see you outside. I'm excited that you're here. For those of you that are new to the Mental Health Foundation and haven't been to one of these events before, we've got a fantastic lineup of speakers that are going to be rotating on and off the stage. And at the back, you'll notice a couple of cameras. We're actually live streaming the event all the way around Australia. So if you do need to scratch something, just do it off camera, okay? Couple of basics before we get started. Just an acknowledgement of the traditional landowners of the land on which we meet today. We're paying respect to the traditional and original owners of this land, the Whadjuk Noongar people, and paying respect to those that have passed before us and extending that respect to any Aboriginal and Torres Strait Islanders among us today. Now, the National Mental Health Month is an initiative of the Mental Health Foundation, and this Miners Mental Health Symposium forms a part of a series of events that we're holding this month. So if you're interested in any of the other events that we're running, we have the walk this coming Sunday at Perry Lakes at 10:30. Yes? Just double checking. I was like 10 a.m. or 10:30. You don't want to turn up at 10 and be standing there by yourself going, am I in the right place? So it's at 10:30 on Sunday. The purpose of Mental Health Month is to raise awareness of mental health right around Australia, but mining in particular is a special group, and I'm sure I don't need to tell the people in this room about the kinds of challenges that that particular industry faces in the space of mental health. This year's theme is post-pandemic recovery challenges and resilience, and I think if you've been around the mining industry or the FIFO sector over the last 18 months, we're not out of it yet. You know, we're not done. So as much as we say recovery, we're still in pandemic challenges. I think we're very optimistic in choosing a theme of post-pandemic for this year's month. So with that in mind, we're extending the campaign wider than ever before. Oh, me, there we go. I'm one of the ambassadors for the Mental Health Foundation, and I'll be guiding us through this morning. We've got a short video that explains a little bit more about what the Mental Health Foundation does. So I'm going to click, and I'm hoping the video is going to be the next thing I click on. Boom. Again.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020 and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country who have a national box for mental health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Results and take up the Wellbeing app Am I OK? to support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, Am I OK? Am I OK also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continued support to our organization as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia.
So the video actually said better than I could have all of the wonderful work that the Mental Health Foundation is doing. So here in Western Australia, we have our board director, Anne Donaldson, who I'd like to welcome up. But I get to talk about you first. I have a whole thing. Anne is a professional non-executive director with over 15 years' experience on state government and not-for-profit boards, as well as state and national government committees. Having worked predominantly in health and human services, Anne has extensive experience in disruption and change management. So she's a little bit of a rebel in executive director roles. And let's face it, mental health can use a shake-up, right? So Anne understands the process of resolution in consumer grievances and has detailed knowledge of strategic and compliance issues. She brings over 30 years' experience in metropolitan and regional Western Australia in senior management, with an understanding of capital works, financial and operational governance. Her roles include community and stakeholder engagement. She's successfully facilitated complex discussions to achieve consensus and shared agreement of service contracts and program delivery. And she's also just a wonderful all-round human being. So I'd like to welcome Anne to the stage to speak.
Now, if you're coming up the stairs, they're on the other side, so I took the shortcut. Welcome, everybody. I too would like to recognise the traditional owners on the land on which we're meeting today, the Whadjuk people of the proud Noongar Nation, and to pay my respects to their elders, past, present and emerging. I'd like to welcome everybody, but first I'd like to welcome the Honourable Bill Johnston. It's wonderful to have you here again this year. Thank you, we're honoured. And to our to Stuart Albury, MLA, and my local member in Scarborough. So it's, and to all of our wonderful guest speakers who will be sharing their knowledge and insights. So we've got David and Lockie and Dale and Laura, as well as the Honourable Minister and Stuart. I'd also like to welcome and thank everybody who's taken the time to join us today. And as Kylie said, we've got people here in person, but we've also streamed this across Australia and it's available internationally as well. And one of the reasons that we've done that is that we wanted to be able to touch many people, but we also wanted to connect into families because it's so important that it's not just about the people in our mining industry, it's also about their families as well. So we now have got that opportunity. And look, who would have thought 18 months ago I really wished I could have gone to so many national conferences. Now I can watch them in the comfort of my dining room if I want to. So it's the world's changed, and I think we need to take advantage of that. As Kylie said, that the theme for the foundation this year is the post-pandemic recovery challenge and resilience. Of course, the pandemic hasn't quite gone yet, and I think COVID's going to be with us for a long time. But in thinking about the pandemic, it's challenged everybody. And today I'm particularly mindful of the specific challenges for workers in our mining industry. And without trying to preempt what will be shared by our speakers, I'd like to share some information from positive psychology. About 20 years ago, positive psychology took hold. Up until that time, most of the emphasis had been around mental illness and the negativity and the stigma attached to that. And I was particularly interested in some work by Felicia Hubbard on the elements that we need. She's done an enormous amount of research, and she's looked at what are the key elements for us to thrive. So she says it's not just about surviving, but it's about encouraging people to thrive. And she said that it's really important to understand the elements that she's discovered cut across all cultures, and they're important whether we're recovering from a crisis, a trauma or illness, or just using it in our everyday life. So she said for us to thrive in life, these are the elements. We're human beings and we need to have meaningful human connection. So she said that's the first and most important element. But she said within our lives we also need to have a sense of autonomy. That is, that we can make choices about ourselves and that's not totally taken away from us. But we have to do it within the social context that we're in. A sense of competence. That is, that we're effective in what we do, we're open to new experiences, and that we can learn from those things that don't go well. A sense of what is going well in our lives. She was saying that it's really interesting that we can spiral into negativity, but if we can actually limit negativity and focus on the positive, it makes a huge difference in the way that we look at our lives. And then finally, she said we need to have a sense of meaning. That is, that we can make a difference beyond ourselves. And I think that those five elements really rang a bell with me, and I thought about them and I thought, yes, and they apply within workplaces. So this week, as I was sitting on my exercise bike reading the Harvard Business Review, I came across a piece of research by an organisation in America called Gartner. And they do wellness surveys, and they focus on about 77 organisations in America. And they were saying that this year, or over the last 18 months, that a number of organisations in these organisations have reduced their financial budgets. But what they have increased is their programs for staff on well-being and mental health. But what they noticed was that although this had happened, employees weren't picking them up, and there was a major issue around this. So they put forward 3 suggestions, and they said that increase employee understanding of well-being needs and offerings. They said that often people don't understand what's available to them and why they might need to use them. And they said that when they actually surveyed the employees, they found that 42% thought their organisations didn't offer anything, when in fact they did. But probably the next one, they said you need to reduce the stigma and the apathy. And they said that this is due to fear of being stigmatised. And they said that it's really important to have champions within the workplace. People who feel comfortable about reaching out and making contact with other people that they can see are distressed. They said there's another cohort that are really important in this space, and it's managers. And they said managers need to be thinking about how they can reach out to their employees and how they can lead by example. And they were giving some examples of how managers can talk about their own well-being and then invite employees to do it too, without going over the top. And then finally they said reduce the time and effect needed to participate in wellbeing programs. And by that they were talking about the importance of getting people to not opt in but only have permission to opt out of programs, so it becomes an integrated part of what they're doing. But they said also that good competitions go a long way and staff love to be in competition with one another. And they said that that was really important. And so I'll leave those thoughts with you as we move forward with the conference today. But before I do finish, I'd like to send a special thank you to Ritika and to our multicultural ambassadors in Kylie for all of the work they've done to get this Mental Health Month into place. It's not a mean feat and they've done a fantastic job, so I'd just like to say thank you.
So if you haven't figured out yet that our list of speakers this morning are incredibly accomplished, they all come with a bio. So I want to make sure I include all of it. So Anne, thank you. You've heard Anne's bio. Now we're going to invite Bill Johnston, Minister for Mines, Petroleum, Energy and Corrective Services to the stage. But hang on, I've got to go through your bio too. So the Honorary Bill Johnston is Western Australia's Minister for Mines, Petroleum, Energy and Corrective Services. He has been a Minister for the McGowan Labor government since March 2017 and has previously been Minister for Commerce, Industrial Relations, Electoral Affairs and Asian Engagement. I'm watching him closely in case he needs to correct me. So far his achievements include cutting red tape for the mining industry, introducing the Work Health and Safety Bill and assisting in revolutionising Western Australia's energy system. In opposition, he served as Shadow Minister for State Development and Energy from 2012 and Shadow Minister for Mines and Petroleum from 2013. He was a member of the Economics and Industry Standing Committee and Deputy Chair of the Inquiry into Domestic Gas Prices from 2010 to 2011, and prior to entering Parliament, he was the State Secretary of WA Labor from 2001 until 2008, responsibility for all state and federal election campaigns. Did I miss anything out? No? And I can also tell you that he's never been injured in the gym. He can tell you why. Thank you.
Thanks, Kylie, for that introduction. And I want to begin by acknowledging that we meet on the traditional lands of the Noongar people and pay my respects to their elders past, present and emerging, and thank Anne Donaldson for the invitation to join the Mental Health Foundation here at this important seminar. I also want to acknowledge my parliamentary colleague Stuart Albury, and I think that when you hear Stuart speak, he'll show that the Labor Party is very lucky that we've attracted such high quality people to contest the 2021 election. And the people of Western Australia are very lucky to see such a wide variety of West Australians going into the Parliament to represent them. And when you hear Stuart's story, you'll see that we're very lucky that he decided to be our candidate and meet our quota of surfers to get into Parliament. How about this for a statement? Mining is a tough game played by tough blokes who get on with the job and don't whinge. So if that makes you cringe, and not just because it excludes women, we should remember that it's not that long ago that was the attitude that was brought to this industry. And it's good that attitudes are changing, and we do need to look at each other in a different way now. Maintaining a mentally healthy workplace is no longer just a slogan, it has to be about good business practice. And we have to become aware of the benefits that it brings to the industry. I was very pleased in April 2019 when I launched Australia's first FIFO mental health code. The code has identified hazards and risks, such as work demands and low levels of controls, and has promoted strategies to deal with them. And I congratulate the Department of Mines, Industry Regulation and Safety in working with industry to enforce the code. I just want to comment about why the code came into being. The code was a direct recommendation of the Jacobs inquiry into mental health in the mining industry, in the FIFO mining industry. And so what we were doing is we were responding to data. We were responding to data that said we needed to take action. And we've also seen that in the way we've increased resources for the department, particularly in the general industry sector, so they've now got the more inspectors so they can do more work to bring their activity up to the national average. Again, responding to data. We also responded to data by introducing the work health and safety legislation that I was very pleased to steer through the Parliament last year, and I look forward to it being implemented from the 1st of January when the regulations are all in place and it can be practically applied. And I congratulate Stephen Dawson as the Minister for Industrial Relations and also the Minister for Mental Health, who is taking carriage of implementing that legislation. Again, responding to data, responding to the changed circumstances of workplaces in Western Australia, the need to properly hold to account employers in respect of workplace deaths. So I do need to just make a quick comment about the challenges that have been demonstrated by the current discussion about sexual harassment in the workplace. Now, the problem for the government was that we didn't have the data. So when this issue was raised in the media, we were advised by the department that in the previous 10 years there'd been 18 claims of sexual harassment brought to the attention of the department in the mining sector. When they then engaged with the West Australian Police Force, they found that there was approximately 40 over the previous 5 years. In other words, 4 times more issues than had been reported to the department. And then when we saw the submissions by some of the companies, we saw that, you know, with one particular company reported that they had 48 complaints in 2 years. So it was exponentially greater problem than the data that we had available to us. And of course the government is reacting to that. But I just make the point, we have to have the data to drive the decisions. And in the absence of the data, we couldn't make decisions. And I just make the point, because it's been, you know, my comments have been in the media and I want to say them again. There was a lack of reporting to government of this challenge, and therefore, because that was not being done, we were not in a position to properly respond. And however we are. I'll also point out that the Equal Opportunity Act had been passed in 1984, and the Equal Opportunities Commission has existed since then, with specific responsibility for dealing with sexual harassment in workplaces. And I just remind people that there's a 1992 decision of the former Equal Opportunity Tribunal, now subsumed into the State Administrative Tribunal, which, if you want to look it up, it's called Horn and McIntosh versus Clough Joint Venture, which clearly set out the obligations on employers to provide a safe workplace free from sexual harassment. So the idea that somehow this is a new challenge is not correct, and that somehow that people are confused about who's responsible for providing a workplace free from sexual harassment and therefore mental health challenges is also wrong. It's absolutely clear that it's the employer's responsibility to provide that. Now, we have engaged specialist mental health inspectors through the Mine Safety Directorate, and those inspectors are qualified psychologists, and they've worked with a number of workplaces to provide enforcement action as well as education. And I congratulate them on conducting audits into mining workplaces using the Mentally Healthy Workplace Audit Tool. The tool it's available on the DEMERS website can also be used by employers and workers to identify psychological hazards that pose mental health risks. This tool was published in August of 2020, and up up till July of 2021, there's been 27 audits conducted by the Mine Safety Directorate. And the data collected has been used to develop and maintain mentally healthy workplaces. And information from these audits has been collated, grouped into key themes and presented to industry during inspection and subsequent audits. It's important that we adopt a risk-based approach to the management of psychological hazards and risks, so that risks are limited. Not all psychological hazards and risk factors have been considered, but they need to be identified and, where possible, removed. It's important to remember that it's the obligation of an employer to remove hazards in the workplace. It's not an obligation on employees to adapt to the hazards that exist. And I also emphasise that if we're going to have access to all talented labour that the industry needs, industry will have to respond both to the challenges in mental health and the challenges in sexual harassment to make sure that these hazards, hazards like bullying, inappropriate sexual behaviour and workplace violence are removed if we're going to continue to attract and retain the talent that we want. With 18% of Western Australia's resource industry employees being women, you can see that we're missing out on the talent of another 32% of the workforce. And if industry wants to attract those missing labour opportunities, then industry needs to respond to the needs of the workforce and not the other way around. It's also important that, remember, these are not just about providing guidelines and then leaving it up to others to do the right thing. This is about employers accepting their responsibilities to remove hazards in the workplace. It's also important that information and reporting is not siloed into human resource responses that look at discipline and other matters rather than the risk factors that are affecting mental health and sexual harassment in workplaces. And once the department has enough data, we can then respond to the challenges in workplaces and work with industry to provide feedback, if you like, a report card on the success of managing these hazards. We can celebrate relative successes and raise awareness of challenges that need to be dealt with. And this can be done across industry, led by the department, but working with industry to make sure that we are eliminating and controlling all of these hazards. I want to congratulate the industry on its strong provision of support services to individual employees, but again, as Anne Donaldson commented, that there should be participation in those sort of programs should be the expectation and not a response to poor outcomes. So the department is continuing to respond to trends in psychological occurrences and hazards, particularly instances of sexual harassment, and we will continue to see that response growing over the next period of time. State Mining Engineer has written to all relevant mine site and exploration managers outlining the department's expectations on reporting exposures to psychological hazards, remembering that that is already a legal obligation. The Deputy Director General of the Department Deputy Director General Safety Regulation at the department has also sent similar correspondence to the Chief Executives of companies that are principal employers in the West Australian mining industry. It's clear that we've come a long way, but it's just as clear that there are still more challenges to overcome. We are pleased that the industry is responding to these challenges. We understand that that response will have to improve over time. We also acknowledge that our inspectorate can be better resourced and do better and I hope that you'll be able to see announcements on that topic very soon. In the end, it's the responsibility of management to provide a safe and healthy workplace free from psychological hazards and free from harassment. Workers need to accept their responsibility to their own health and the health of their workmates. That doesn't diminish the responsibility of employers, but it is an obligation of employees to work in a safe and a healthy way. But in the end, it's not about us and them. It's about the industry working together to eliminate these hazards. The government is determined to, as we've done with the first step through Australia's first FIFO mental health code, but we are determined to respond to all these hazards, work with industry, and if we have to take further action, we will do so. But I also want to say that we are examining what other actions we can take to work with industry, to work with employees, to help remove these hazards from workplaces here in Western Australia and our resource sector. I finish by saying everybody understands in Western Australia how important the resource sector is to the success of our state. It's not just the 150,000, in round figures, 150,000 people who directly work in the industry. It's also the benefits that's provided to the broader community, to the Government of Western Australia, to the Government in Canberra, to our balance of trade, to our international trading partners, to our partner customers in Asia who use our resources for their own economic development. We are an important part of the Asian economic success story. To continue to be that valued part of Western Australia, it's now time for us to change our approach to mental health in the mining industry. It's time for us to change our attitude to sexual harassment and engagement of women in our industry. And the Government of Western Australia wants to partner with everybody in the sector to see that transition take place. So thank you all very much. I'm really pleased that I've had the opportunity to come along and join you again at this important seminar.
It's just a look, we really appreciate you being here again this week.
That's right.
That's
That's okay.
It's just a little token, exactly.
Oh, thank you very much. You're very kind.
I know you've got a busy
Yeah, I've got
I realised I'm actually one of the former 18% of the FIFO workers in that 18% female. This is actually my fly-in, fly-out day shirt.
Yeah.
Because as the health and wellbeing officer on an oil and gas rig and forming part of the safety team, winning the guys over was a big part of my role, trying to get them to understand that it was safe to speak and safe to engage. So I used to wear a t-shirt that, I don't know if you read it, whether I was too quick, but it says, "I'm only here to make friends." You know, I wasn't there to get anybody in trouble or anything like that, and it became a bit of a thing. So, thank you very much, Bill, for being here. I'm going to invite Stuart to the stage momentarily. Stuart is part of the former 82%, as a former FIFO worker himself, and having been a health and safety representative on sites that he's worked on as an electrician. He's also making up the surfing part of the Labor Party as well, but in more serious terms, Stuart is the member for Scarborough, and he's a committed member of the Scarborough Surf Lifesaving Club as well, which is where your surfing skills come into play, I gather. Yep, all of that paddling. And he has direct experience of being a FIFO worker. He is an electrician by training and has been working in the resource industry for almost 7 years. He acknowledges how important it is that we invest in good local jobs and give West Australian kids a quality education. And he's working alongside Mark McGowan on Labor's plan to keep WA strong, put local jobs first, and invest in quality education and skills for our kids. He's also a very passionate and committed mental health advocate. I have met Stuart before here at the launch event, and I'm delighted to welcome him to the stage. Thank you.
Good morning, everyone. like to begin by acknowledging the traditional owners of the land on which we meet, the Whadjuk people of the Noongar Nation, and pay my respects to their elders past, present and emerging. I was going to acknowledge the Minister, but he's obviously had to go. He's a busy man. I'd like to thank Anne for inviting me here today to speak, and Kylie for emceeing today. For those of you who don't know me, my name is Stuart Aubrey. I'm the newly elected member for Scarborough. Prior to becoming a Member of Parliament at the state election back in March, I was working at a gold mine in the East Pilbara as an underground electrical technician. I've previously worked FIFO across the Pilbara in iron ore, copper and gold mining. I'm not a doctor, I'm not a psychologist or a psychiatrist, I'm not an expert in mental health. Mental health is just something that I have dealt with since a young age. I've witnessed family members battle paranoid schizophrenia, anorexia and depression. As a gay man, I've struggled with in the past with my sexuality like many in the LGBTQIA+ community do. For me, it was the point of suicidal ideation. I was pulled back from the brink by several friends who asked me, "Are you okay?" Mental health is an issue that I continually face during my time in my 7 years in the mining industry, not just as a sparky, but as a supervisor, an enterprise bargaining agreement negotiator, an elected safety and health representative, and a mines rescue and emergency response team member. During that time, I not only supported my colleagues in their struggle with mental health, but I also fought my own battles. I battled depression, anxiety, and a binge eating disorder. I have done for a long time, although I was only recently diagnosed. As you can imagine, this personal history has made me a passionate advocate for mental health. I began my advocacy back in 2018 when I fought management on site for better conditions to improve mental health and wellbeing for my colleagues. I was able to do this because of some key factors. I was financially stable. I was young, single with no dependents, and in a trade that had many job opportunities. I could take the risk of speaking up and being targeted by management. If they did find a way to put me on a window seat, I would have no problem surviving and finding another job. It's not so easy to speak up for many of my former colleagues who are riddled with debt, have families to raise, bills to pay, and some jobs that are not so secure, and an age that discriminates against them in the job market. Luckily for me and my colleagues, I was not so easily removed. During our EBA negotiation, I played a large part in securing an even swing, family-friendly roster with minimal loss of pay or conditions. This made a large difference in mental health of my colleagues, but many other conditions didn't change. The poor standard of food on site, the unsafe culture of prioritising production over worker well-being, limited cell reception to stay in contact with support mechanisms such as friends and family, and many more conditions that make life unnecessarily difficult for workers on site. Following the EBA finalisation, I continued my advocacy as a safety and health representative. This was a thankless task that often isolated me as a troublemaker or as a pariah, as I constantly raised awareness of mental health around a demographic that generally likes to hide or suppress its struggles. You can imagine how relieved and supported I felt when the state government released the Code of Practice for Mentally Healthy Workplaces for fly-in fly-out workers in the construction and resources sector. It acknowledges the issues and gives a clear framework on how to take practical steps to improve mental health and culture in the mining workforce. I suddenly had the support, research and backing of the Code of Practice introduced by the McGowan Labor government to push management to change its ways. Although I was still met with strong resistance on that side, my colleagues across the resources sector did see some improvements. During the initial stages of the COVID-19 pandemic, the lives of my FIFO brothers and sisters changed dramatically, as it did for everyone in the world. We knew that if COVID made it onto any site, it would be through a FIFO worker coming through our airports, and if it did, it would spread like wildfire. FIFO workers stepped up. We didn't hesitate or question the restrictions placed on us. We covered the shifts of our interstate colleagues in isolation or lockdown over East. We accepted the changing of rosters to limit the time in the airports, all in the interest of protecting the industry, the state, and our livelihoods from the COVID outbreak. Unfortunately, just like the wider WA community, the response to managing the pandemic significantly impacted the mental health of the workers in the FIFO sector. Workers felt the winding back and deprioritisation of mental health and safety on site throughout the pandemic in a work life that is already isolated and at high risk. It's important the industry takes time to review how it is adhering to the Code of Practice, and that as we emerge from the COVID-19 period, that well-being of the workforce is made a priority. I would like to take a moment here today to thank Minister Johnson for his efforts in delivering the Code of Practice. There is further work to be done on this, as the Minister said, and I'm looking forward to working with him as a passionate advocate with experience on the ground and with Minister Dawson to increase the uptake of these measures of the Code of Practice across the industry, to prevent any further suicides of my friends and colleagues in the mining workforce, and so that they can not only survive, but they can thrive. Thank you.
Thanks, Stuart. I'm inspired. I'd now like to invite. Oh, hang on. There we go. David Bradbury, who's the lead chaplain at Fortescue Metals Group. That's what I thought. I've got FMG up here, and I was like, I'll have a stab at it. David is the group chaplain and heads up the pastoral care program for Fortescue Metals and Fortescue Future Industries. He's a fitter by trade, industrial engineer by profession, and Anglican priest / chaplain by vocation. Excellent. It's a bit like me. I have many hats: physio, DJ, MC. Besides being given the opportunity at Fortescue to walk with people in their space and time, David believes our physical, mental, emotional, and spiritual well-being are interrelated. He and his wife Christine have 5 children and 6 grandchildren. Wowee. And when the weather is right, he enjoys motorcycling with his mates. Please join me in welcoming David to the stage.
Thank you, Kylie. I too would like to acknowledge the Wedger people of our nation and the traditional owners, past, present and emerging. I'd like to thank you, Stuart, for sharing this. It's very powerful. Thank you. I also want to acknowledge anybody who is currently struggling with their own mental health challenge. And I want to say thank you to those who are supporting them. It's really important the way we support each other and the way we come together. And when you're in them dark spaces, we need others around us. And often workmates, family, friends, we're the ones who will notice when something's out of kilter. And we need to act on it. Don't sit on our hands. Take action. Okay. So that's very important. And thank you, Anne, for inviting me back. Talking to Anne, there's a couple of things Anne asked me to share with you. One is she asked me to explain a little bit more in depth about what we do as a chaplain. What is a chaplain? And the second one is how the COVID situation has been affecting us at Fortescue. So what is a Fortescue chaplain? Well, first thing is, don't get hung up on terminology. That is really important. We're pastoral carers. As it was said, I happen to be an Anglican priest and a chaplain as well. But you don't have to be belonging to an ordained member of a particular faith tradition. As chaplains, what we look for is somebody who has a faith tradition of their own, something which they can actually hold, because we believe that spirituality is part of who we are as human beings. And I would say if you stop and take 5 minutes, you will all agree that we believe in something. We just want you to be able to articulate it and work out how it manifests in your life. And also, like Anne was saying, one of the positive psychological things is interconnection with each other. As human beings, we need social interaction. And it doesn't always come very easily through the social media. That physical, that contact, that being together. We need to be with the living. That isn't always human beings. It could be a pet. If those of you who've got dogs will find that your dog's probably the holder of all your family secrets. But they give us great comfort. And that ability to be able to articulate where we are is so important. It really is. So whether it's a dog, a cat, it could be gardening. Just getting in touch with Mother Earth and watching a flower grow, bud and bloom is so precious. But whatever you do, connect with something that's living. I really encourage that as much as you can. And it could be your loved ones, and I hope it is. There you go. So at Fortescue, what we look for is, we have 5 guidelines. What we say is we're custodians of stories. That's the other story, not our So confidentiality is crucial. Right? And providing that opportunity, some call it cup of tea ministry, some call it just sitting having a chat, allowing the other to just be who they are in their space. And yes, we're not psychologists, we're not counsellors, and that's why we define ourselves as chaplains. We have a great EAP system, Employee Systems Programme, who we refer on to constantly, and we use, as well as other professionals, which we use depending on the particular situation or the help the individual wants. So there's 5 guidelines we follow. First one is to create a safe space where people can share their emotional needs, wants, fears, whatever it is at the time. Now this, on mine sites, this can be pretty hard because it can be pretty intense. You're in the same environment with the same people for your whole swing. And that can be, you can often find it hard to find some space. And a lot of blokes don't like to sit and talk. However, take them for a drive. Go down and ask them about their job. What do you do, mate? Get them to explain it. Break down them barriers. Connect with them in their space at their time. And as chaplains, we have chaplains across all our sites, and it's about making that face-to-face relationship and building on that. So create that safe space where somebody can be vulnerable enough to just share whatever they need to at the time. Secondly is value the person as a unique individual. You know, there's over 7 billion people on the planet at the moment, and we're all unique. None of us are the same. We walk together at times, we cross over each other's paths, we meet, sometimes we never do meet. But each and every one of us has a unique story. Unfortunately, a lot of people never get a chance to tell that story. So create a safe space where they can tell their story as much as they want to, without probing or anything else. Allow them just to be. And in that, I'll guarantee the individual feels valued. The third thing we do is we support the individual in prayer or action, in whatever way that is for them. We're not there to proselyte, we're not there to impose anything on anybody. You know, it could be just doing a mindfulness exercise, it could be meditation. Depends on what the person's tradition is. Meet them where they're at. But that also includes their families. Support their families as well, when it's appropriate and when we're invited to do so. So, you know, we've got over 50,000 in FIFO workers at present, I believe, in WA. That's 50,000 families, not individuals. We're all connected to other people. Them people that do need as well, and they need supporting. Very, very important. And that support could be referring them on to a professional organisation or our EAP provider or whoever. But we refer on a lot in that case. Now, the fourth thing we do, which I really love to do, is to celebrate. Find out what's important for the individual. Ask them what gives them joy in life. And it's the simple things. We can all get excited by the hype and everything else. But what are the simple things that give you joy in life? I say I've got grandchildren. Have you ever stopped to watch your children or your grandchildren sleep? At the end of the day, and you go, oh, thank God. Right? Well, spend 5 minutes and just appreciate that, rather than just going on and doing the next thing. Bask in that joy, in that safety, that security, that love that's there. It will feed you, guaranteed. You might do it in other ways. It could be watching a sunrise or a sunset. It could be watching the moon caress your lover's face while they sleep. There's many ways in which you can get these simple joys. We get too caught up in the doing and the being and everything else. Slow things down, learn to pause a little bit. the last thing we do is we help develop strategies with management and family members for those who are addressing emerging trends, which brings me to the second point I mentioned about COVID. So there's someone employed in the hard rock mining industry, because the oil and gas have been devastated. Yeah, they're doing it really tough. I've not been affected by the lockdowns that other states and countries have had to endure. In WA, we've had it pretty good. In hard rock mining, we're in a double bubble because we've maintained our jobs. A lot of people in WA have not maintained their jobs. There's a lot of insecurity, and that brings a lot of fear. And we need to be mindful of each other and be very careful we don't create a have and have-not society. We are one society, which is really important. Very significantly for us at Fortescue is, and personally I've been truly blessed, because in my family we have not experienced a COVID death, yet many of our people have. Overseas, we have a lot of employees who have family connections overseas. And this has created a great deal of grief, loss, insecurity, heartache, because we haven't been able to be with their family at these very important times. And that's a tragedy. And yes, it's great having social media like we do, but zooming into a funeral is not the same. Being told that you can only have 20 members at a funeral makes life hard. So there's a separation and a loss there which needs to be acknowledged. For our eastern states and overseas people, many of them, they've missed the birth of children. They've missed other significant events. We've got guys, and when I say guys I mean male and female, who wrestle with, do I go home and risk lockdown? Or do I stay and just, I'm at R&R in Perth or in WA. Some, unfortunately, especially the ones who are connected overseas, haven't been home for over 12 months, nearly 18. And there's no side inside family present. So some are doing it really tough. We need to remember that. As saying, WA, we've been really blessed by the freedom that we've got and the ability we've got to travel and to be together. But what are the positives from COVID? Because there are some. Right? Greater acceptance within Fortescue of flexible working. In areas where we really struggle with, is it possible, should we do it, not do it? It's just taken on. And it's created a lot more freedom for people, which is good. But there is a balance there. People need to learn to balance work and home. And we need to draw firm boundaries in how we manage that and how we do it. Otherwise, the two will encroach on each other. So if you're in that situation, be mindful. It can be a great plus, but it can be a trap as well. As all things, it has a positive and a negative. It depends how we use it. Collegiality has grown in many ways. The support of some of our teams to their teammates from over east has been wonderful. You know, things like Father's Day, when guys couldn't go home over East to be with their families. And our guys invited them into their house. You know, little things like that make a big difference. So if you know somebody, and this can apply to any workplace, not just mine. If you know somebody in that situation where they're separated, encourage them to be part of you. That belonging is really important. And And stigma around mental health concerns, it's something we've been wrestling with, and I believe we're going to continue wrestling with. However, COVID has opened up many doors. Because we are now more freely talking about mental health conditions and challenges in general society, that's actually given our guys on site far more freedom to talk about it. People who I would not have thought of mentioning it a couple of years ago, they're now asking to go on mental health awareness courses, mental health first aid courses, and things like that. And that's a great plus. It really is. So that general awareness is growing, and I think that's something we need to really develop and push more. And also, like you said, in positive psychology, one of the things is if we make it mandatory for some and a can-do for others, it really helps. And in some areas we need to. Supervision, leadership roles, things like that. We need champions in the workforce. People who are equipped not to fix things, but to listen and pass it on to the next person. It really is important. And the listening is crucial. We're also working more closely with Lifeline in how to equip our leaders and have extended our employee assistance programs to residential communities in the Pilbara, using local services, which rather than Perth-based services. We still have Perth-based services, but we've found it actually better to have people in situ, and that's working really well. So they're just a couple of things we are doing. However, acknowledging that mental health is real and seeking help is what we have wanted. Unfortunately, this is also creating an immersion problem, and that is access to treating professionals. We do have a shortage. The waiting lists to get appointments are growing, and that is something as a society we need to address and plan for the future. It's all right saying let's get rid of stigma, but where are people going to go when we do that? It's all part of it. And the work the department's doing on psychosocial conditions and the code of practice, thank you. That's really important. And we'll keep moving that to the future. So moving forward, something we can all do at work or at home is create a safe space. Value the individual, support where appropriately, celebrate with people, and develop strategies to move forward. Thank you.
Thank you, David, for speaking so eloquently. FMG are really lucky to have you. I'd like to invite Lockie to the stage now. I'll just pull up your gorgeous photo with his happy smiling face. I've known Lockie for quite some time. He's a former FIFO worker, and he's become one of the leading FIFO mental health ambassadors right here in WA. He's seen his mental health podcast open up, go to the top 10 in Australia and New Zealand, and he's co-founded the FIFO Mental Health Summit, FIFO Happiness, a FIFO-only EAP service, and the Association for Mental Health in Mining. I know. Lockie, through FIFO Happiness, uses a blend of lived experience speaking, mental and emotional health education to aid in creating trust, breeding vulnerability, which he is a master of himself, and imparting actionable tools for personal and organisational change. Thank you, Lockie, for sharing your time with us this morning. I did not press anything.
Hello.
Do you want to talk to
my
slides? You can talk to Laura's slides. Hang on, just
Go for it, Laura.
sorry, we just got an issue. We've got like a preview of no, it's not going anywhere. That should come up now.
While I'm up here, if everyone wants to look down the back left-hand corner, the man with the grey beard, Paul, can you raise your hand? This is Paul Archer. He's from ISS, and I just wanted to acknowledge him because for someone in his position leading an organisation like that, he's at every single one of these mental health and mining FIFO resources events that is available. So I really appreciate you, and I want to acknowledge you because I feel like you deserve it. Alrighty. Nearly. So generally what I do when I'm doing these talks is tell a little bit about my story, and I'm sure a lot of people here and watching down there on the videos, live streams have heard that before, but for the people who don't know me, I've come from FIFO, spent about 10 years as a SCAF bro. So when you say you're a Sparky, I know your pain when we talk about memes, it's always about scaffolders and Sparkies. But I spent about 10 years in that industry and went through my own hardships. A partner threatening to take her life and attempting, my own depression, my own attempt, and then wasting hundreds of thousands of dollars, like a lot of people do in this industry. And so all of that culminated in me being evacuated from site, from Wheatstone in 2017. And as a result of being evacuated, for being suicidal, I got to launch that podcast, which then gave me all these opportunities. They weren't opportunities that I planned for, they were just opportunities that come organically because I was doing something that I was passionate about and I'd been from the industry. So what I'm doing here today is really just speaking about some of the stuff that I touched on last year, how that went, and then what's coming up and what's currently happening for me and for FIFO Happiness, which is the previous organisation I was with, and then for these organisations that I'm working with. So last year at the Symposium, we presented the Trigger 5x5, which is a document we created around human needs, and that it's taken a long time to get traction and get that into organisations, but that's finally being piloted. So hopefully one day when we get some of that data back, we'll be able to present that. And then the summit last year, so the FIFO Mental Health Summit, went really, really well. I was really proud of that, and KP actually, Kylie, got to speak at that. Absolute gun speaker, if you need a speaker for your mental health event, especially in mining, she's a go-to. And then the last picture is the FIFO tour. So after the summit, it's like, man, I really want to do a tour of WA, go to all these sites and meet these people, be face to face, share my story, and hopefully connect to an extent where they feel that we've created enough trust and we resonate so that they open up to me. And so that tour, after the summit, we gave ourselves 6 weeks to put that together, and we ended up going all over the place. So the tour, we ended up, thanks to Mineral Resources, Sodexo and Maida for supporting that. We ended up going to 15 sites, doing 38 workshops or presentations, got all over traditional media, had a lot of one-on-one conversations, which within those formed the way that I would approach mining and mining mental health in particular from that moment on. And then one of the things I didn't take into account when planning this, driving all over WA in a truck, with a really good human called Robbie, is that travelling and driving that many Ks is not rest. We were going back-to-back sessions all the time, and I thought travel would be rest. It definitely is not. And so I guess what's happened since that FIFO tour of WA at the end of last year was I've won the National Men's Health Champion from the Australian Men's Health Forum, which I feel very lucky to have received. Co-founded the Association for Mental Health in Mining, as you heard, which is really just a place for us to have sundowners. Now this is something that we debated. It's like, can we do a mental health event and have alcohol? And we to and froed, and the consensus, my belief, is that if we want to get people to buy into the vision, if we want to have them there to connect, to network, and to ultimately, connect and collaborate to create that change down the line, we have to meet them on their level, which I believe we have to do on site as well. And then the third picture is Therapy Focus, a partner of ours, FIFO Happiness Co. We've started because of our work with WebDrill. Lovely lady sitting down there, if you can raise your hand, from WebDrill. Because of our work with them over the last 8 months and having so many outreaches, more than normal in terms of what they were traditionally getting or generally getting to the EAP service, we realised that there was a need for a FIFO specific EAP service. And the difference with this, the innovation and what we believe will become a disruption, is that instead of having an admin be the first point of contact, we now have ex or current FIFO workers who have lived experience, who have now been upskilled in mental health first aid and suicide assist, so that instead of, you know, when someone finally gets the courage to pick up that phone and say, hey, I'm really, really struggling, they're not getting an admin that says, we're really booked out at the moment, it's going to be 2 to 3 weeks before you get a call or an appointment. You've got someone who knows the industry, who has lived experience from that industry, who you can connect with, who can give you empathy and compassion, not give you advice, but just be there for you to listen, which is what most people need. And then from there, that FIFO support worker will debrief with a health professional, a psych or a counsellor, and then decide the next steps. So I'm really proud of that. And then currently, going on at the moment, it's Resources Industry Mental Health Check-in Week. So AMHM, which is the association in partnership with 1 Million Lives and Peter Slocum, we're doing a check-in for the resources sector, hoping to get to 5,000 mental health check-ins, which is on a tool called 1 Million Lives. I noticed you posted about it yesterday or the day before. It's really simple. It takes 5 to 7 minutes, and at the end of that, it gives you a score. It tells you where you're at, what you know you can't unknow, and then it gives you a report and suggestions to improve your mental health score as well. So we've got about 34 to confirm again, so 30 partners at the moment, organisations within the resources sector who have committed to that. We're at 741 check-ins at the moment, at the beginning of day 3, and Paul was our first one on board, so thank you again, Paul. But if you want to be a part of that, please see me later and we'll get you an info pack, a partner pack, and we can set that up so you can run that through your organisation and help them check in on their mental health. So what's coming up? For me personally, I've just stepped away from FIFO Happiness, so I'm going out as the FIFO Mental Health Guy. I didn't know what to call whatever I was doing. I didn't know what to call it, so luckily Cherie from WebDrill was like, your Instagram says FIFO Mental Health Guy, that's so you. So now I'm consulting for mining companies, and at the moment the way that's working is that I'm creating custom workshops because I have to create a whole new range of content, and luckily that's my jam. That's what I love, creation and delivery. Number 2 is we've got our next association sundown on October 20, thanks to Scope Australia, a SCAF company, yes, getting behind mental health. We've got that on October 20, so if you want to be there, please see me or go ahead and visit my website, lockiesamuel.com. And then lastly, we've got the FIFO Mental Health Summit 2021, which is at Optus Stadium, which I feel really blessed and lucky to, you know, have that opportunity to do an event like that at a venue like that. It's going to be 200 people, and the idea behind this event, the theme behind this event for the Mental Health Summit 2021 is to connect organisations to the people, the ideas, the innovations, and the disruptions that can ultimately help them create that mentally healthy workforce within the FIFO sector. I think, it's touchy. That's it from me. I know I've gone over my time, but I'm very grateful to be here, very grateful for this opportunity, and KP, Tika. It means a lot to be in this position where I get to use my voice. One of my taglines is, I use my voice to speak truth into transformation. I believe that every single one of us in this position with a story, with the courage to speak up and lead the charge in the sector, we're all doing the best we can, and we're doing a damn good job. So, thank you.
Thanks, Lockie. We need to update your branding. The FIFO Mental Health Guy. So next up we have Dale Henderson. He's the COO of Pilbara Minerals. Mr. Henderson is an engineer with experience in both mine operations and development in the resources sector. This experience has included brownfields and greenfields environments.
You can leave that on.
Laura's the next one up, according to your slides. I don't know where Dale's photo is. Apologies. We'll find it. Dale, you did give us a photo, didn't you? You think you did? All right, cool. That's all right. We'll catch up. He's worked for a range of major resource operations, including Fortescue Metals, Rio Tinto, Chevron, and Occidental Petroleum. Prior to joining Pilbara Minerals, Mr. Henderson held leadership roles with Fortescue Metals Group in mine operations and project development. Mr. Henderson commenced with Pilbara Minerals in 2017 to lead the delivery of operations and development objectives for the company. Dale, would you please come to the stage?
Thanks, Kylie, and no photo required. I'd probably prefer it that way. Good morning, everyone, and hello to those who are dialing in online. Look, it's an absolute pleasure to be here, and thank you to the Mental Health Foundation for the great work you do. I think this is, of course, such an incredibly important topic, and I'm delighted to come in and help out. And I do feel somewhat inadequate looking at the lineup, having known David for many years, who's just a giant in the space, and Lockie I met actually last week, who has devoted himself to this area, and Laura I haven't met, but look, wow, you guys, I do feel a bit inadequate. But what I hope to do is make up for that with some passion, which I do have for this area, and the story that we have with Pilbara. And with that, I'd just like to acknowledge a couple of the team who have come in today, Charlie Burns, we've got Ian Zlatnik somewhere, there he is, and Jane Aberdeen, who within our business are actually the true champions, driving so much of what we have done as a business and where we're heading. And for me, I think this is the key piece, and the piece I'd like to add to the lineup here is to make an appeal for anyone who's in the audience here, either within the room or online, who's got the ability to influence what's happening in your organisation, because we feel there is so much value to come from this space. And Anne spoke about moving from sort of a survive to thrive mode, and that's basically been what's underway and manifesting for our business. So I'd like to think we're an awakened miner, and we're into a really positive chapter. So what I'd like to share with you is really in three parts: a little bit about where we've come from as a business, the way we're thinking about the next chapter we're entering, and lastly, a perspective on how we think the mining industry needs to switch up the way it thinks about this space. So starting with Pilbara's journey, well, firstly, who are we? Well, we're a hard rock lithium miner. We're 3 years old in operation. We're actually the world's largest independent hard rock lithium miner. So we're a big fish in a small pond. We've got a $5 billion market cap, and life is good in lithium today. But it wasn't always that way. Back in 2017, we kicked off, and by the time our operation was running, there was a massive decline in the lithium market. It absolutely plummeted, and it laid waste to quite a few businesses within the lithium ion supply chain. And that was incredibly tough for our business. So, and it took the form of us absolutely being in survival mode as a business. We went through 2 rounds of redundancies, and during the year of 19 into 20, we went through a period of what we called moderated production, where we only ran our operation at actually 30% of the time. We finished FY20 with a $100 million cash loss, and through that journey we had to do a number of capital raises. So against that backdrop, you could probably appreciate work pressures across our business were immense. And a manifestation of that, of course, was, well, we knew that, and we knew that we needed to get active around supporting our team. So we went to work at that. So it was, the start for us was very much around, gee, how do we survive? How do we support our team? What can we do? And we went on and did all the sorts of very sensible things we should do around mental health first aid training, EAP. We made sure that they were coming to site on a regular basis. Lots more contact time with our individuals. And yeah, pleased to say that's gone really, really well. But not only did we have this incredible period of business pressure and challenges, after all that was done, at the end of calendar year 19, or around that time, we actually had a murder on our site. And some of you may have seen actually in the last 24 hours there's been a bit of an update on the court bookings for that particular matter, being booked in for February next year. But again, another incredibly challenging moment for our team, our contracting partners. So yeah, a couple of years of incredibly tough times which really tested our team. So yeah, as I mentioned, we had lots of strong reasons to make sure good levels of support were put out across all of our organisation to make sure they were supported in the best way possible. Now, so we did those things, but what really surprised us is the central theme for us has just been about care, and through that care fanned out to all these various initiatives around mental health first aid, as I mentioned, the other types of frontline leadership that we put in place. But what really surprised us with it all was a cultural shift at a foundational level in such a positive manner, absolutely astounding. And what we're seeing is just a different organisation come to the fore. We've got passionate leaders who are deeply connected with their teams. It's surprised us, absolutely surprised us, in such a positive manner. And I think that this is, coming back to the survive to thrive aspect. The thrive aspect of this type of area is completely misunderstood and not appreciated. And Pilbara is a bit of a working example of this awakening that I mentioned. And what we've found now is this cultural shift has actually enabled us in so many ways. So obviously we survived. We're absolutely on the other side of that now. Two, as we've needed to expand and attract more people, we've had no problem attracting people. The internal surveys we've done tell us what you all know, which is 80% of our recruitment is through word of mouth. Doesn't matter how many ads are on Seek, it all boils down to phone call to phone call. What's that site like? Is it a good camp? Are they good people? What's the leadership like? So, and it's through that we've had no problems, despite how challenging the recruitment market is, we've had no problems filling the new roles, which, by the way, we've had to do a lot of because we ended up buying out our neighbour. And by the way, we just announced this morning that we got first concentrate from that plant. But Charlie and his team have been peddling like mad things to employ that team. Charlie, how many people did you have to recruit?
About 110.
110? And it was a doddle, wasn't it? He's going to kick me when I walk out of it.
I'm pretty sure I didn't put it that way, but no.
But we went into the recruitment exercise thinking this is going to be incredibly challenging, and maybe this will actually threaten the whole investment and the whole startup. But as I say, we were pleasantly surprised. But I actually think, and the position I'm putting to everyone, is at its heart was about having a really great place for people to work, which is about showing care, and that care fans out to this multitude of aspects. So, awakening it is. So where to from here for Pilbara? Well, we're pretty excited about what this has done for us and what the next steps could be. So what we're starting to look at is exactly that. It's like, okay, what does the next step look like for us? So in that category, what we've done is we've engaged with Symposium, our camp provider, and we put the challenge to them, and we said, we really want to create an incredible place for our people. You guys have got service camps all around the globe, and in particular Australia. Can you come out, tell us what we can do differently. And they've done exactly that. They brought a nutrition expert up, they brought a health and lifestyle expert up, they brought someone who comes up and looks at the physical layouts, and they've delivered to us a very comprehensive set of recommendations which which range from very basic type ideas, some more expensive ideas, through to some very low cost but very, very sensible quick wins. By example, putting video booths in the dining hall. Idea being that if someone wants to have dinner with their kids, well, why not? Why not set up a booth where they can sit there, closed off, have that dinner at home with the kids on the other side. So low cost, easy to implement, no-brainer. Has it been done before? I don't know of it, but you just think, wow, what more could be done? So we've engaged with Civio, we've been engaging with Lockie, FIFO Focus, one of our partners, and again, putting that challenge to them around how can we build on what we've got. And what we're finding is there's just more and more things which we can do. So we're going to get on and do that, because why wouldn't we? And we can keep building on the momentum that we've got and truly create that great place for our people. And then through all of that, of course, we're talking about mental health. We've got our frontline leaders integrating it into the vernacular that is just part of the discussion. Isn't safety, it's mental health, it's how you're going. It's all part of a fabric which is the base environment that our team works in. So that's where we're heading. So to finish, a couple of views on mining industry. And I think this is the big shift that we need to see change, and the Honourable Minister quite rightly, he talked about the necessity to see this shift underway, and it's so good that we're seeing more momentum now, and may that spotlight glow bright on this area, the areas around harassment, long overdue, is my personal view. So the proposition I put to the mining industry is we really need to think about mental health in the same way we think about safety. Now, if you think about safety 25, 30 years ago, it was pretty loose. And if you think about it where it is today, it's completely different. And I just want to compare and contrast safety to mental health, so bear with me. So if I think about safety in the mining and resources industry today, it's prized as core business. It's talked about one and the same with production and financial outcomes. Mental health doesn't. You don't hear it. It's treated as a bolt-on. Business outcomes. The data shows a safe site is a more productive site equals a more profitable site. In mental health, there's tacit acknowledgement of this, tacit, but it really should be sung from the rooftops. In safety, connection with home. It's recognised that a good, safe site and acknowledgement of safety flows back to the home and then back to site. Mental health is the same, and I don't know why that's not talked about more. It's a win-win in all regards. In safety, we've got really elaborate standards. There's standards for everything around what is the minimum, what does that look like. In mental health, we don't have that yet. We should have. There's some basic ideas around what the norm is, but I think so much more can be done to represent what great looks like, what the minimum standard looks like, and I actually think this could be a sales point for employers as we've organically stepped into through our own experience. And lastly, as it relates to safety, the expertise. We employ deep expertise for our operations, and we hardwire it in through our planning, through our operation, through all aspects. And that hardwiring and focus and investment, we need to take the same approach in mental health. That would be my pitch to the mining industry. Think about mental health in the same way we think about safety. If we get that right, it will transform our businesses and it will transform lives for people, and absolutely will stand a better chance of being a catch net for those who are near the edges and really need the help. So, thank you very much for your time. Hopefully there there was something in that for those here and those watching. Thank you.
Thank you, Dale. I also last year spoke about the idea of linking our mental health and physical health together in the same way. That in my offshore role, thinking about the physical safety and the industrial ergonomics of people's tasks, and then looking at the mental requirements and the mental ergonomics and how we can actually link the two together. It's a really beautiful way of thinking about it and making the mental health aspect destigmatised and accessible when we frame it in terms that we're already familiar with, like safety, physicality, physical health. I'm not sure where we are with the slides, so I'm going to let you find Laura's slide, just so I don't click through everything that we've already seen. But next up, I'd like to invite Laura. I actually heard Laura speak late last year, and Bill was talking about data when he spoke this morning, that we need data. Laura is data personified. Laura has all the data. I'll try not to fangirl too much. Laura's a lecturer of applied psychology at UWA, and she's in the School of Psychological Sciences. She received her PhD from the University of Aberdeen in 2012, and she researches leadership, team dynamics, work design, culture, and attitudes at work. But Laura links this back with workplace safety, mental health, well-being, and behaviour. Laura was one of the leading authors of the 2018 WA government-released report into FIFO worker mental health and well-being. Like I said, Laura is the queen of data, and I'm excited to welcome her to the stage.
Thank you so much for having me today and for inviting me to talk to you. Like Kylie mentioned, I never thought of myself as the queen of data, but I'll go with that, that's fine. I've thought I've got 5 minutes, so I will take those minutes to tell you a little bit about what I have learned from looking into FIFO worker mental health over the past 4 years. As she mentioned, I was one of the lead authors of this report. I've really been involved in generating that data that has been mentioned a lot today, but since then also we have gone back and done more research on FIFO worker mental health. And I'm going to show you some of that data as well. So last year when the COVID-19 restrictions were put in place, we saw the news reports, we heard from FIFO workers, and we realized that it's worth going back and just checking in how they're doing. So I'm going to start off with that snapshot for you first. So on this slide, and I promise this is the only statistics I'm going to show you today. The first column on the right over here is showing how FIFO workers were doing in 2018. And this shows their psychological distress. The psychological distress of FIFO workers at that point was three times higher than that of the general population in Australia. So they were already at an elevated level at that point. And when we came back in 2020, having heard about rosters having changed, some of the key protective factors that we'd identified actually in 2018 about social connection that David had mentioned and has come up today a couple of times, we knew that they would have been affected by those really necessary and important health protection measures that needed to be put in place. And we did find that in 2020, when we asked FIFO workers, well, how are you doing now, that their psychological distress had actually gotten worse. And in seeing this increase, it's important to recognize they had already started off from a high level. The general population, and this is research done by other people, they've also increased in terms of their psychological distress, we know that. But FIFO workers are still significantly higher in the level of depression and anxiety that they're experiencing, or the symptoms of that. So having looked at the overall level of how they're doing and how their mental health is, a logical step in 2018 and also in the past research that we've done was to say, well, let's look at the individual pieces. What is making a difference? And this was really important to understand each element of what affects FIFO worker mental health. And I've already mentioned rosters, I've mentioned the social connections on site and the social activities that employers can provide. But this is ultimately an incredibly complex picture because you're looking at a complex issue. So there's several factors at play. And we literally went through and looked at each one of those. And that was really instrumental in providing the information and that data that now has informed the code of practice, but is also giving good guidance to employers and workers in what steps may need to be taken and what things could be changed. But having gone through all of this and really busy collecting data, analyzing data, this year finally, and I don't know how this happened because it's again been a very busy year, I had the chance to step back and actually think about what does all of this mean? And I started to think, well, I've looked at each individual piece, but what does the puzzle look like? So it was time to step back, and this is what I... Can you move the slides? Oh, good. This is what I've sort of reflected on. And this captures the paradox and the complexities or the contrasts that FIFO workers are experiencing. And in my mind, these two aspects, which I'm going to explain in a moment, they reflect the essence of FIFO work. And this is what ultimately we need to understand and address to make a deep impact on FIFO worker mental health. The first one, and this is not actually my idea, this is something that Doro and Jean reported last year in a paper on Canadian FIFO workers, and they identified that one of the key challenges of being on a campsite and working in FIFO is the blending of your personal and your work life. So you go to work, you work on the site, you come back to the camp, but yet you're still on an employer schedule, you're eating employer-provided food, you're in employer-provided accommodation. There are rules you need to follow. You're not quite in control of your own life. And this is quite interesting because in this instance, when you're on camp, on the site, you have like this blending and meshing of your personal and your work life. But yet at the same time, FIFO workers experience this incredible contrast of being far away from what their home life is. And this is what I've called fracturing. There's this clear separation between the home life and the work life. And it's a necessity of where the stuff is that you need to dig up. But it's really important to acknowledge that this is a key challenge for workers. They're missing out on important occasions. They're missing out on birthdays, celebrations, being with their family. And I think there's two things to really take note of with these two aspects, the blending and the fracturing. The first one is how different they are. There's a clear contrast between them. And now imagine being a FIFO worker and you have to cycle through this constantly. You're going from a meshed life where work and life is really connected, while at the same time, your home life and your work life are clearly separated, and you can never be in two places at once. And yet, FIFO workers cycle through that constantly. What does that do to them? We're not quite sure yet. I guess we get the overall picture, but the details of how they're managing these processes, how they're managing these transitions, I think it's really important that we recognize those two aspects as the key challenges of FIFO work. And that's me done. Thank you so much.
Thank you so much, Laura. We've reached the part of the morning where it is time to grab a morning tea, cup of tea, glass of water. I think there are a few snacks outside as well. Because we are running quite behind timing-wise, if we could just take 10 minutes, grab something, eat, come back into the room so that we can invite our panellists up. And their microphones are already up here for them. So 10 minutes and we'll be back in the room. Thank you so much.
and I actually passed a motion at the Labour State Conference last weekend as a resolution to reinforce what's already been sort of practice, but it's kind of an alignment to do with practice. And I gave a speech about that and passed that resolution to the state last weekend. There wasn't any resistance, which means
want a muffin? There's some muffins down the back. Yes, that'd be great.
May I please invite our panellists up to the stage? They need no second round of introductions, I believe. I think we're good. But if I can have the four of you up here, please. Now, ideally, I would like you guys to have some questions for these fabulous people up here. Do you have some questions? Crickets. Okay, I guess I should start then. Yeah, I'll kick off with my first question. So, Dale, you described an almost utopian place to work where you're doing mental health really well, which sounds amazing. You know, and no, really, like it did. It sounded fantastic. And one of the things that I tend to come away with from these mining mental health events, because as Lockie pointed out, I've been to a few, is that we're constantly hearing that it's mental health in crisis, that things are not, you know, and you shared a recommendation around the video booths in the dining hall, and I wondered if you would be willing to share any of the other findings or recommendations that you're going to implement to improve mental health in your workplace. And I'd like to ask Laura to weigh in on that as well, with the wealth and benefit of her data around what things you have discovered that improve mental health in the workplace. And both Lockie and David will also be able to contribute on things that you've seen improve individuals' mental health with the people that you've worked with. So essentially, I would love everyone in the room to leave with an actionable step around how they could improve mental health in the workplaces that they work in. Is that a good question for you guys? I figured you were all thinking it, you were just keeping it to yourselves. Yeah, great. To the panel, please.
Okay, thanks for that. It does feel like a trap, but it probably...
If it's worth mentioning.
If it's proprietary information that you can't share, we understand entirely.
No, it's fine.
Okay.
And probably a point of clarity, I'm sure that the team from site would say we haven't achieved a utopia, and but we've certainly got the aspiration. And that list of couple of initiatives is very much hot off the press. Mm-hmm. You know, we had Sevio in 2 weeks ago. That pack landed with me last week. So we're going through the throes of really stepping out that strategy. So we're yet to sort of have committed to all of them, but so many of them we really like the look of. But you asked, you know, what other initiatives are there? One of the other areas we've talked about but haven't yet acted upon is what we've heard is that a key source of stress for our FIFO team is around relationship stress. So that got us thinking around what can we do around training to enable and equip our FIFO team so that they've got better skills which would obviously not only help on site but help at home. And I was just actually quizzing my learned colleagues here around if they could recommend a place. But that's the type of initiative which is on the drawing board, which I think is really sensible. And Charlie, who's here, is our chief architect who's actually pulling together a lot of these ideas. But we're keen to pursue and do as much as we can.
Wonderful. So that would be in the forms of communications training and self-development?
Yeah, that's right.
That sort of vein?
Yep. So we're looking at, I guess you'd say, a holistic approach and try a combination of that comms training. I touched very briefly around very much the camp life, the nutrition elements, exercise elements, the physical layouts, some of the basics, making sure we're doing that. We've done camp surveys, those types of things, which absolutely recommend if people aren't doing those. And we do have some basics to solve for. So we're by no means utopia yet. We've got basics to solve, but we've also got some of these more out there thinking we're keen to pursue.
So once you implement them, you'll change the name of the camp to Utopia? I'm teasing.
Probably not.
It's okay. Anne?
Just ask you a question. So given what Laura was saying around the blended and the fracturing, how do you open up that discussion with workers and with their families, because it seems to me that that can be sitting over here and being the elephant in the room rather than actually opening it up for discussion. And I think with that information now on the table, it provides a really rich environment to sort of start and understand, well, how do you address those issues and how do workers step into that and manage their FIFO life?
So again, this is also hot off the press. We ran a session yesterday exploring this very topic around how to, firstly, what's the vision we're setting for ourselves and the business, and two, what's the machinery we're going to build to both engage with the full group, assess what we're going to do, and then get on and implement it, but implement it in such a way that we're getting traction, we're getting results. And the loose thinking we have around that is we're setting up a steering group. Charlie's going to lead it. I'll be part of the team, and we've engaged with our site leaders who are thinking through what would be the representation, such that we can make sure we've got the whole organisation engaged in the process.
Maybe I can comment a bit, because I think what you're mentioning with, for example, the training that you're thinking of offering, that's really great, and it's sort of empowering the individuals to do the right things and to learn about how to connect with their family. And I think there's a couple of things also that employers can do, and I know you've done some of those already, like, for example, try and get to even time rosters, if not better, if you can. Really important. That makes a huge difference, not just for the FIFO worker mental health, but also for the families. The other thing is flexibility from the employer. If there is an emergency at home, or if there is a birthday, is there any way you could adjust and make it possible for that person to be there for that moment? The other thing is also, what we know is that one of the key pressure points for FIFO workers is these transition phases. So particularly before they go back on site from home, but also when they get ready to go back home and arrive home. This is where they sometimes feel a bit lost, and it's really, they need to find their back into each space and each place. They come back into a family life, and maybe it feels like they are being a bit redundant because they haven't been there. Someone's worked out a system that works without them, especially when you've got kids. How can you support them as an employer as well to sort of make those transitions easily and help them with that? I think those are sort of the things that I would suggest to focus on.
I guess just to add to that, having spoken to a lot of people over the last couple of years in terms of that fracturing, a lot of that fracturing comes from people when they're overwhelmed, especially when you're on site or you're the partner at home looking after the kids, being overwhelmed and not knowing what to do with that feeling. And then, within that feeling, the coping mechanism then becomes, I'm going to avoid having that phone call tonight, I'm going to go to the pub, or I'm going to stay late at the gym instead. And if we just taught people how to have hard conversations, quote unquote hard conversations, if we taught them how to, number one, identify their values, the behaviours that align with those, if we teach them how to identify what their boundaries are, what are their expectations of themselves and the people around them, en route to the person that they want to become, and if we, number three, identify their needs, then we can teach them how to communicate those so that we're in this relationship and in this dynamic where we're just this cohesive organism who can go to and fro and balance each other out.
I think one of the other things is, and I mentioned this last time, is find out those who are doing it well, and get them to talk at toolboxes, things like that. And different phases throughout the year, we actually see, there are certain times of year when certain issues are going to creep up. I can virtually guarantee round about February, there'll be a debt issue because credit card spending over Christmas, and it comes in beginning of February and children are going back to school. So these all raise issues. So look at the cycles throughout the year of what's going on, and build things into your program to address these as before they come up, not when they come up.
Yeah. Oh, we have someone. We've inspired some questions. Yes, please.
It's not so much a question, but rather a statement. I work in masculinity mentoring for men, and I work with quite a few guys in the industry. And over the years, I've gone to a lot of these summits and conferences and heard there's a huge amount of research and, I guess, programs being put in for guys that are on site with
Thank you. One of the things that Stuart spoke to, and he's had to duck away to Parliament, was that when he chose to step up and speak up in the EAB agreement, he was in a unique position that he didn't have dependence and a huge amount of debt to manage and the opportunity to move into another role. And when I started FIFO, a lot of people joked about the golden handcuffs and having an exit strategy. And one of the things that I'm also wondering about is whether it crept into any of the recommendations or law, or whether it's popped up as a trend within the data that you've looked at, that perhaps teaching our FIFO workers some forms of financial management would be of benefit in that space?
Yes, so it's definitely crept up in the data. We've measured the golden handcuffs with quite an established concept actually in the workplace psychology literature. It's called continuance commitment, where people just stay at work because they don't have any other options. And that definitely is a contributing factor to FIFO worker mental health. And I do think, there is sort of this long-term planning and also giving people the perspective of how long are you going to do this, and then experiencing it, and then asking again, what's your plan now? So of helping them making plans and going into FIFO work with open eyes to say, you're going to do this for how long? Because some of the people that we interviewed for our research, the ones that had a plan and said, I'm going to do this for 5 years, they did incredibly well. And they really made the most of this. And they had a target, they had a goal, and then that really worked well for them. Some of them then continued to do it for a bit longer, because it was working so well for them. And that is, I think it goes to what you were saying about looking at the people who are doing it well. So I think the assistance in planning and also providing these perspectives where you're headed is really important.
I would agree with that, and I think the exit strategy is a really good point, especially where the golden handcuffs comes in. Sooner or later we're all going to move on, in whatever way that is. But to have that cash flow, to be able to actually leave when you want and be able to maintain your lifestyle for at least 3 to 6 months whilst you re-establish yourself is so important. Because if you don't have that, you get resentful about having to be there. And that resentment will creep into your daily lives. And so I think really encouraging your people to have that, the goals are really important, but also have that financial planning and do it with a professional and get good advice, but actually build that into any programs you're doing so that your people can not feel compelled to stay.
Because ultimately also that's not good for your workplace. You want people to be there because they want to be there and they are enjoying being there. The moment this becomes, not everybody enjoys their work, and I don't think everybody has to. Being a workplace psychologist, obviously, I would love for everyone to just love being at work. But I understand that that's not necessarily a standard that we need to work towards.
We all have off days.
But just to also recognize, there's clear benefits for you as an organization to have people who want to be there, and for people to enjoy being there, for people to feel supported. It is affecting your bottom line. It's not just a nice to have. There's clear statistics around. It makes sense from a business perspective to look after your people, to create the work that is good for people. So in terms of the workload, the supervision you've got, etc. It's just, you've got retention. You've mentioned how easy it was to, you might disagree, but how easy it was to recruit people into a good workplace. So all of those things are ultimately going to be positive for your organization, and to not see mental health as an expense. It's an investment. Look at it that way.
Charlie, you raised your hand. Sorry, Anne, we'll come back. Yep.
Yeah, your question about the differences between mental health needs of families versus single people. So probably the question with me, and Lockie, we discussed this when you came in the other day. David and Laura, is there differences from your perspective about the mental health needs of males versus females in a FIFO perspective? Obviously, traditionally, FIFO has been male-dominated. The industry is really trying to change that. How should we be approaching our initiatives and our support of females being FIFO? Should there be some customisation there?
I think the first thing is talk to them and then listen. Ask your females a question. What is it they need? What is it they want? How can you address that? And then listen to their response. Rather than imposing on them, this is what it should be, that's what it should be. And the same for the males. And I prefer to look at it more as a masculine and feminine than male and female, personally.
Yeah, I think I'll definitely agree with that. Listen to them. I think there's sort of two things that are important to take into account. There's that one, that we know women are more open to exploring mental health and well-being issues. So you could actually use that as an opportunity and really work with them around those things. The other thing is, but also to recognize the context in which they're in is potentially threatening and they have additional challenges. So I would recommend highly to work with them to identify some of those issues, like what would actually help you. And it could be just basic things around feeling safe and feeling like you're able to move around the site freely or the camp without being worried about your safety. So I think they will definitely tell you if you ask. Yeah.
And did you want to wrap up with one final question? We have time for just one more.
Okay. So what I was just going to ask is, we talk about financial planning, but career planning I think is so critically important. And I've seen examples where people have been tucked away and forgotten about, and you bring them out and they just thrive because they're given the opportunity to start and plan. But given that the mining industry is going through such major automation and change, I would have thought that it's really important to have career planning programs in place for staff so that they can see that they've got a future and they're not just stuck in being a FIFO worker in a spot, but they can actually expand and develop and move on. And so that succession planning is really important.
I could probably offer a couple of thoughts here. Absolutely, we need to offer a level of career planning and support. The question we wrestle with is to what extent, and the knowledge that everyone's on a journey, their own career journey. They've got to do their own heavy lifting, and conversation we've had internally around some of our high performers is we're absolutely keen to help them out, and we're saying to the level of various training and various support, and they're not picking up the phone. So we've had to encourage a few to get active around what ultimately everyone has to chart their own path. I think what we need to do as an employer is do the best we can around supporting that, but we can't spoon feed them. It's a sort of a balancing act, but absolutely we need it. And the other reflection I had listening to the conversation is around the financial planning. There is for the industry at large has got a massive challenge around, even with automation coming into play, the forecasts through the CME are a massive shortfall of people. So that can only be solved through attracting more people in. Those people won't be experienced in mining and all the resources. Therefore, it's incumbent on industry to step up, work collectively around that training and look holistically at that life cycle of flow of new to resources coming through and an off-ramp for those who have been in the industry. So that's one reflection. One other reflection on the financing piece was golden handcuffs. We're going into a boom cycle, and I hope we don't see some of the retention mechanisms which featured back in the last boom. There was a very well-known resource group who had a retention scheme which involved accruing a percentage of their income, and it was at their election when they paid that out, and the particular project got extended, and the people who were tied into that were walking zombies. Not healthy at all. But anyway, so just flag that because I strongly encourage that type of mechanism is not healthy for anyone as we move through this next boom cycle.
Now, we have capped our time for our wonderful panellists. You're, collectively being able to pick your brains is an enormous privilege. So I'd like everyone to put their hands together to thank our panel as they exit the stage. And we'll just have one final video of the Mental Health Foundation walk that we need to screen for you now. And then I will close the event. But I do hope you'll join us on Sunday at Perry Lakes at 10:30 a.m. The meeting point is on the MHFA website, correct? For where we're meeting at Perry Lakes? But yeah, the video now.
Australia, are you ready for a challenge, and that too for a good cause? Then look no further. Join the MHFA as we walk for mental health across the country on the 17th of October at 10:30am in each state and territory capital. Worried about COVID? Well, we've got you covered. We have launched our MHFA app where you can walk virtually raising funds as an individual or in a team. Visit our website for more information about getting started. So come on Australia, our journey to better mental health starts with one step.
So I hope that we'll see you there on Sunday. I'd like to take this final moment to thank Ritika and Anne for pulling all of this together today, and all of our wonderful speakers and presenters for bringing their collective wisdom and energy. Thank you all so much for being here. We definitely do not take lightly the fact that you've given your time to be a part of this morning's event, and have a wonderful rest of your week.
And thank you too.